What is a high-risk pregnancy? A high-risk pregnancy is where you or your baby are at increased risk of health challenges during or after delivery. Some of the circumstances that may increase your risk are: 1 is pregnancy history. History of conditions such as 3 or more pregnancy losses, preeclampsia, preterm birth, or diabetes puts you at higher risk of the same diagnosis in future pregnancies. Complications in the current pregnancy risks can emerge during pregnancy, such as slowed growth of the fetus, rhesus blood group incompatibility, or bleeding from a low-lying placenta. 2nd is multiple pregnancies. Carrying more than one baby is associated with unique challenges different from singleton pregnancies. For example, there is a higher risk of smaller for gestation babies, premature birth, high blood pressure, and diabetes. 3rd is maternal health problems. Having medical conditions such as heart disease, thyroid issues, epilepsy, poorly controlled asthma or diabetes, high blood pressure, or kidney disease increases the likelihood of pregnancy complications. This may be from the effects of the condition itself or from medications used to manage it. 4 is lifestyle. Use of drugs such as tobacco, shisha, cannabis, alcohol, heroin, and cocaine all have a harmful effect on a pregnancy. Obesity and inactivity also can cause pregnancy complications. Genetic conditions. Being affected or being a carrier of certain genetic conditions such as sickle cell, thalassemia, and glucose 6-phosphate deficiency may convey a risk of complications during pregnancy or a risk of passing the condition on to the baby. What to do for high-risk pregnancies? Going through a high-risk pregnancy has its ups and downs, which can be draining physically, emotionally, and financially. High-risk pregnancies will require special monitoring or care during pregnancy. This requires a coordinated approach by consultants and specialists in various fields. The specialist is needed to work together with the obstetrician. This is called multidisciplinary care. It requires facilities for specialized care to be available if required. An example of such facilities is the Newborn Intensive Care Unit, or NICU, Adult Intensive Care Units, or ICU, and Adult and Newborn High Dependency Units, or HDU. Caring for high-risk pregnancies may require preconception assessment, closer antenatal visits, specialized screening, like performing genetic tests or specialized ultrasound scans, interventions, for example, early delivery for severe high blood pressure. 6 tips to prevent having a high-risk pregnancy. Regular prenatal appointments are critical to monitor both your health and the health of your growing baby. At each appointment, your doctor can track your progress and address any concerns early on. Only 6 to 8% of all pregnancies are high risk. Although most women experience normal pregnancies, learning more about common complications during pregnancy can help you make smart choices for your health and your baby's health. Every pregnancy is different. Some pregnancies start out low risk, and complications like gestational diabetes or preeclampsia develop mid-pregnancy, and mom and baby need special medical care. In other cases, women may have high-risk pregnancies from the start. If you're pregnant or thinking about getting pregnant, schedule an appointment with your doctor to help you have the healthiest pregnancy possible. Some factors that contribute to high-risk pregnancy can't be changed. Women carrying multiples, including twins or triplets, are often high risk. But there are changes you can make to increase your chances of having a healthy pregnancy. Find out more about 6 things you can do to prevent a high-risk pregnancy and book your first prenatal appointment today. 1. Maintain or achieve a healthy weight before pregnancy. Being overweight or obese while pregnant increases your risk of developing a variety of complications, like high blood pressure, preeclampsia, gestational diabetes, and stillbirth. If you're planning to get pregnant, achieving a healthy weight before pregnancy reduces your risk of complications. Follow a healthy diet and get regular exercise to lose weight and maintain a healthy weight. While pregnant, follow the doctor's guidelines for weight gain to ensure a healthy labor and delivery. 2. Manage pre-existing health conditions. Uncontrolled pre-existing health conditions can make a pregnancy high risk. Common conditions that can affect pregnancy include high blood pressure, heart disease, diabetes, sexually transmitted diseases, STDs, and HIV, and autoimmune diseases like lupus or multiple sclerosis. Pregnancy takes a toll on your body. Managing health conditions with medication and lifestyle changes before pregnancy helps your body work at its best while you're pregnant. Take prenatal supplements. While you're pregnant, your body needs more of certain nutrients to support your growing baby. Taking a prenatal vitamin or supplement can give you folic acid, iron, protein, and calcium that you aren't getting from your normal diet. Talk to Dr. Serrano about your nutritional needs. If you're planning to get pregnant, it's a good idea to begin taking a prenatal supplement before conception. Taking prenatal vitamins after your baby is born can be helpful if you're breastfeeding. Avoid alcohol, tobacco, and drugs. Drinking alcohol, smoking, or using tobacco products and taking drugs while pregnant can significantly impact your baby's health. If you drink alcohol while you're pregnant, you increase the risk of fetal alcohol spectrum disorder, which causes serious birth defects. Smoking cigarettes can cause low birth weight in babies. Using illegal drugs or misusing prescription drugs can cause birth defects, and it's even possible for babies to be born addicted to a drug used during pregnancy. Take only the medications prescribed by your doctor during pregnancy. Know the risks of older maternal age. Your risk for pregnancy complications increases beginning at age 35. These complications include difficulty getting pregnant, miscarriage, and genetic abnormalities in the baby. Fertility begins to decline slowly around age 30 and speeds up for women 35 and older. Common complications that mothers 35 and older may face include premature birth, low birth weight, gestational diabetes, preeclampsia, and needing to have a C-section birth. Women in their 20s are at the lowest risk for complications during pregnancy. Talk to your doctor about your risks if you're pregnant or planning to get pregnant later in life. Visit the doctor regularly during pregnancy. Regular prenatal appointments are critical to monitor both your health and the health of your growing baby. At each appointment, check your vital signs and measure the baby's progress. If potential issues are identified, such as gestational diabetes or preeclampsia, then the doctor will develop a treatment plan to give you the healthiest possible pregnancy and birth. Taking steps to improve your health before and during pregnancy can make a big difference for you and your baby. Top mamas take precautions to avoid high-risk pregnancies. Like and subscribe for more of these videos.